You're welcome back. This is your friend okay. Let's talk about nosebleed and some common causes. Nosebleed are often a result of injury from direct trauma or object lodged in the nose. However, they may also be a sign of another health condition like high blood pressure, low platelet, or hemophilia. Talking about nosebleed, it occurs because the nasal lining contains tiny blood vessels that are close to the surface and can easily be damaged at any slightest trauma. Slight bumps to the nose and changes in the hair, especially when the environment becomes drier, can make the nasal membrane more susceptible to nosebleed. Nosebleed can be easily treated with direct pressure and cold compress application to the bridge of the nose. However, you should see your doctor for assessment if nosebleed are frequent or add to clot, or if they occur with symptoms like dizziness, fever, or vomiting. Some of the causes: direct trauma. Nosebleed can occur from nose injury, like a strong blow to the nose or a broken nose. A fracture happens when the nasal bone breaks or cartilage tears, and this can result in nosebleed. Other symptoms include swelling of the nose, bruising around the eyes, sensitivity to touch, visible deformity, and of course, difficulty breathing. Number two, high blood pressure. Normally, high blood pressure does not present with any symptom, but they can start to emerge if blood pressure exceeds 140 all over 90 millimeter of mercury. In these cases, you may experience nausea, dizziness, strong headache, nosebleed, ringing in the ears, shortness of breath, excessive fatigue, blurred vision, and of course, chest pain. Then, of course, if there is foreign object in the nose, sometimes, especially in babies and children, nosebleed can occur due to objects stick in the nose, like small toys, pieces of food, or garbage. In addition to nosebleed, other symptoms can occur like discomfort and difficulty breathing. And of course, it can be a low platelet. People who have a low platelet count we have higher risk of bleeding as they have a lower capacity for blood clotting. They can have symptoms like bruising, redness in the skin, like bleeding gums, nosebleed, you know, or blood in the urine or stool, heavy periods and wound with hard to control bleeding. There is something we call deviated septum. A deviated septum can occur for many reasons, like previous trauma to the nose, local inflammation, or bad effect. It decreases the width of the nostril and can cause difficulty in breathing. Sinusitis, fatigue, nosebleed, and difficulty sleeping due to snoring. Number six is hemophilia. And this hemophilia is just a genetic and hereditary illness that results in clotting abnormality. And some of the common symptoms include bruising, joint swelling, joint pain, spontaneous nose or gum bleeding, and difficult to control hemorrhage. Even a small cut may result in heavy bleeding, and menstruation is often excessive and prolonged. Then, of course, we have sinusitis. That's the inflammation of the nasal cavities. It can cause nosebleeds, headaches, and a feeling of facial heaviness, especially around the forehead and the cheeks. Generally, sinusitis is caused by an influenza virus, but it can also be caused by the growth of bacteria within nasal secretion, which becomes stuck in the sinuses. Medication usage. Frequent use of some types of medication like nasal spray for allergies, anticoagulant, or aspirin can interfere with blood clotting and can cause easy bleeding, even in the nose. So, whatever you're going through, you don't understand, kindly see your doctor for evaluation, assessment, and evaluation. See you in the next video.